Hello from Precision Assess, and welcome to the Deep Dive. If you've ever looked at Washington State's healthcare system, especially for specialized services, and just felt lost, well, you're not alone. It can feel like a real puzzle. But today, our goal is simple. Cut through that complexity. We want to give you clear, actionable insights.
Exactly. We're going to pull back the curtain a bit on the Washington State Healthcare Authority, the HCA. We'll talk about what they do, but more importantly, how understanding their services can really help you or someone you care for. And we'll specifically zoom in on something called Intensive Behavioral Support Services, or IBSS, plus how having the right support, like, what we offer at Precision Assess, can make navigating it all much, much easier.
Okay, sounds like a good plan. A shortcut to getting informed.
Precisely.
So let's start with the big picture. The Washington State Healthcare Authority, HCA, it sounds like a major player. What exactly is HCA? What's its main job for people in Washington?
It really is a major player. What's fascinating, and maybe not widely known, is that HCA is actually the largest single buyer of healthcare in the entire state.
The largest buyer? Wow.
Yeah. Think of them like the state's main shopper for health services. Their big mission is to lead the charge in changing healthcare. They want Washington residents to have, and this is their phrase, better health and better care at a lower cost. And they really rely on data, information, and working with local communities to try and achieve that goal.
Okay, so they're trying to improve things system-wide. But what does that mean for an ordinary person? How does HCA actually help me get healthcare?
Right, the practical side. Well, HCA runs several really key programs. First, probably the most well-known is Apple Health. That's Washington's Medicaid program. It offers free or very low-cost healthcare. So if you live in Washington, you or your family might qualify for medical, dental, vision care.
The basics, yeah.
The basics. But here's a key insight. It also covers a pretty wide range of behavioral health services. We're talking mental health support, help with substance use issues, and even recovery support like peer counseling or help finding housing or a job.
That's much broader than people might think.
It really is. And you might wonder, okay, who can get Apple Health? Well, it's for lots of different people. Individual adults, parents, caretakers, pregnant individuals, kids, folks 65 and older, or on Medicare, people needing long-term care, even kids in foster care.
So quite a wide net.
A very wide net. The actionable thing here for you is, if you need help getting health coverage, absolutely check if you're eligible for Apple Health. Don't assume you're not.
Good advice. What else does HCA manage?
Second, they handle employee and retiree benefits. This isn't for everyone. It's specifically for public employees, school employees, and folks retired from those jobs. You might hear terms like PBA or SEBLABE, that's the Public Employees Benefits Board, and the School Employees Benefits Board. HCA manages those.
Ah, okay. So
Yep.
if you work for the state or a school.
Exactly. Or if you're retired from one of those jobs.
Yeah?
HCA is your resource for managing your health benefits. You can compare plans, check costs, see eligibility, enroll, figure out options if you leave your job.
Got it. Your go-to benefits place.
That's right. And third, HCA also has resources for the other side for providers and partners. So for hospitals, clinics, doctors, nurses, therapists who want to treat Apple Health patients, it covers things like how to sign up to be an Apple Health provider, how to handle billing and claims, getting paid. They have a whole system called Provider One for that.
Okay, so they manage the patient side and the provider side. Makes sense. Now, you mentioned behavioral health under Apple Health. That's such a critical area for so many families. Can we dig a little deeper there?
Yeah.
What specifically does HCA cover for mental health and substance use?
Yes, absolutely. Behavioral health is a huge focus, and rightly so. It covers a lot. For mental health, you've got support ranging from crisis lines for immediate help to acute care if things are really serious, even help for issues like problem gambling. For substance use, they cover treatment for alcohol and opioid use disorders. And they have specific programs designed for certain groups, like pregnant individuals, children, young adults. There are even special behavioral health services tailored for American Indians and Alaska Natives.
That's quite targeted.
It is. And beyond just treatment, there's a strong focus on recovery support. Things like peer counseling, talking to someone who's been through it, recovery housing, and also prevention programs, trying to stop problems before they start.
So it's a whole spectrum of care.
Exactly. The takeaway is, if you or someone you care about need support for mental health or substance use, Apple Health likely offers a service that can help. It's worth looking into.
Okay, that clarifies the broader HCA landscape really well. Now, let's zoom in, like you mentioned earlier, on Intensive Behavioral Support Services, IBSS. What exactly is that, and who is it really designed for?
Right, IBSS. So connecting it back, IBSS is a very specialized part of those behavioral health services we just talked about. It's specifically created for individuals who have really complex behavioral health needs and live in places like adult family homes, assisted living facilities, or enhanced services facilities.
So not someone living independently at home, usually.
Generally, no. It's for people in these congregate settings. The main purpose of IBSS is to provide really intensive, specific support right where they live. The goal is to help clients who might otherwise end up hospitalized or potentially even evicted from their home because their behavioral needs are so challenging.
Ah, so it's about stability, keeping them in a stable, home-like setting.
Precisely. It's about providing that specialized support to maintain stability and avoid crisis situations or displacement.
That sounds incredibly important. What's the key thing to understand about qualifying for IBSS? You mentioned it's for complex needs. Does that mean it's clinically focused?
Absolutely, yes. It is very clinically driven. And this is a really crucial point. It requires proper, detailed assessments done by a registered nurse, an RN.
Okay, so not just filling out a form.
Definitely not. We're talking about things like initial health assessments to really document the level of care someone needs, and ongoing nursing care plans. Think of the care plan as the detailed day-to-day roadmap for how staff will provide support and manage specific behaviors.
Right.
These assessments and care plans are absolutely fundamental. They are the evidence that shows why someone needs these intensive services. If they aren't thorough or accurate, the whole process can stall.
That makes sense. The documentation has to justify the intensive level of service.
Exactly.
So if you're, say, an adult family home provider, or maybe you're advocating for a resident who seems like they benefit, how do you actually apply for IBSS? What are the steps involved?
That's a great practical question. The process has clear steps.
Yeah.
But knowing where the potential roadblocks are is key. Step 1, connect with the MCO. That's the managed care organization.
The client's health plan. Right.
Exactly, their Apple Health plan.
Yeah.
You have to contact them first. They're the gatekeepers, essentially. They provide the necessary forms, explain the contract details. My biggest tip here, ask them immediately for their specific IBSS packet. And confirm their exact clinical and behavioral criteria right away, because sometimes there are slight differences between MCOs.
Okay, MCO first. Get the packet, check criteria. What's next?
Step 2, start the application with DSHS. That's the Department of Social and Health Services. You'll submit the client's documents, and if your facility isn't already licensed to provide IBSS, you start that licensing process too. This is where having really solid documentation like your caregiver care plans becomes critical. And understanding things like nurse delegation.
Nurse delegation, what's that?
That's where a registered nurse, following specific rules, can delegate certain nursing tasks to qualified caregivers. It's important for providing some of the care under IBSS.
I see. So MCO, then DSHS, and licensing, making sure paperwork is spot on. Step 3.
Step 3, understand the timeline. Generally, approval takes about 4 to 6 weeks after all the paperwork is submitted correctly.
4 to 6 weeks, okay.
But here's a major catch, and a common reason for delays: missing placement assessments or incomplete care plans. We talked about how important those RN assessments and plans are. If they're not done right, or something's missing, expect delays. Being super thorough up front saves so much time.
Right, diligence pays off. What's the final step?
Step 4, getting the actual hours approved. This isn't just getting accepted into IBSS. It's about determining how much support, how many staff hours are needed. Here, you work really closely with the client's whole care team and, crucially, again, with the registered nurse. Together, you have to clearly define the specific behavioral interventions, what exactly staff will do, and then estimate the staff hours needed to provide that level of support effectively.
So it's very detailed planning.
Very detailed. It requires a solid clinical understanding of the client's needs.
That step-by-step is super helpful. But wow, listening to it, I can really see how things could get snagged, especially around those assessments and care plans. It sounds like a lot for a provider to manage on top of everything else.
It absolutely can be. You've hit on the exact challenge many providers face. And honestly, that's precisely where expert support can make such a difference. This is where Precision Assess comes in. We're nurse-owned and operated. I'm an RN myself, with over 15 years doing thousands of these kinds of health assessments. I've seen firsthand how critical, accurate, compliant documentation is, especially for complex programs like IBSS.
So you specialize in that assessment piece.
We do. Our whole mission is to provide flexible, reliable, and compliant assessment services. We specifically help adult family homes get that crucial documentation right. We create custom care plans tailored specifically to meet the requirements for IBSS approval. So if you need help with that clinical or assessment side, that's what we do. fast, compliant, and compassionate service.
Okay, so how exactly do you help? What services do you offer that tackle those IBSS application hurdles?
Great question. We offer several key services that directly address those pain points. First, placement assessments. We do thorough assessments before someone moves in to make sure the home is a good fit for their needs. This helps prevent issues and delays down the line, including with IBSS approvals.
Proactive, okay.
Yes. Second, nursing care plan services. We don't just do the initial plan. We develop and help manage ongoing, individualized care plans. These plans make sure care is coordinated, meets all the regulations, and is easy for caregivers to follow. And importantly, they're customized to help secure those IBSS hours.
So you handle that complex planning piece.
We do. Third, nurse delegation. As we mentioned, that's essential for IBSS sometimes. Our licensed RNs can delegate tasks safely and compliantly to qualified caregivers, ensuring high-quality care. Fourth, client health and benefit eligibility assessments. We conduct really accurate evaluations. We can do them by phone, video, or in-home visits. These are vital for clearly demonstrating the client's true health status and the specific care needs that justify services like IBSS.
Phone and video options too. That sounds convenient.
We try to be flexible. That's part of what makes us stand out. You choose the format. Our team is all licensed, experienced RNs providing thorough reports with clear, actionable insights. And we use modern tech, even some AI-driven tools, to streamline things. This means our nurses can spend less time on paperwork and more time focused on providing great care and accurate assessments.
That makes a lot of sense.
And one more thing, we even offer elderly support services via nurse triage. If a caregiver has a question about a new symptom, a fall, medications, they can get timely professional nursing guidance from us, helping them know what to do next.
Like a nurse advice line specifically for these settings?
Kind of, yeah. Bridging that gap between I'm not sure what to do
Yeah.
and taking the right action.
Okay, that really paints a picture of how specialized support can streamline a complex process. So, wrapping this up for our listener, what's the main takeaway here? We've gone from the big HCA picture down to the nitty-gritty of IBSS applications.
I think the biggest takeaway is understanding just how fundamental those clinical assessments and care plans are. They're not just paperwork. They're the foundation for accessing these vital services.
Right, it's the key that unlocks the door.
Exactly. If you're running an adult family home or you're trying to help a loved one get the behavioral support they need, getting that clinical documentation right with professional support can make all the difference. Getting services like IBSS approved really hinges on having accurate, detailed, and compliant assessments and plans.
So for you listening right now, whether you're a caregiver, maybe a facility owner, or just someone navigating the system, the actionable step seems clear. If the clinical side, the assessment piece, the care planning for IBSS feels overwhelming, or if you need help with placement assessments or nurse delegation, expert help is available.
It really is. Don't struggle through it alone.
And here's something to think about after we finish. Imagine how much smoother healthcare could be if every complex application, every confusing process had this kind of expert guidance readily available. What other parts of healthcare desperately need this kind of clarity and support? Just something to ponder.
That's a great thought. And if you do need support now with an IBSS application or any nursing assessment or care plan needs for your facility or a loved one, please reach out to Precision Assess. We're here to help make that process clearer and more successful.